Brunchers, beware. Injuring your hand due to a fall or fracture is typical. And while it might sound like a laughable term, what occupational therapists call avocado hand is one of the most serious hand injuries of them all. In this Eye on Health report, I talked to a local specialist about avocado hand and the dangers imposed by the trendy fruit. It's common.
Fractures, I mean, we have a lot of older ladies right now that have had fallen down and had a wrist fracture.
Mary Helm, an occupational and hand therapist with Our Lady of Lourdes, says she often sees a variety of hand injuries, like this patient who is in recovery from a cut on her hand that turned into a staph infection.
We are working with her scar, trying to stretch her scar, made that splint for her today so that her thumb, the web space would be open so that she can use her hand more, and working on getting her hand stronger so that she can go back to work. She hasn't been to work in about a year, and we're just trying to get her back to where she can get back to work.
But brunchers, beware, as reports show that an increase in patients with avocado hand is on the rise.
It's really not safe to hold an avocado in your hand. You can cut like a nerve, you can cut a tendon, and tendons it's very common to cut a nerve, tendon, or artery, and it's a bad injury. And it's a bad place to have an injury.
An avocado injury is a flexor tendon injury. Flexor tendon injuries typically occur from a cut on the palm side of your fingers, which is why these types of injuries are common when cutting avocados.
Well, if you think about it, we don't have a lot of fat there, right? There's not a lot of fat in this area of your hand. So it's easy to slice really important structures.
The proper way to cut an avocado is to place the avocado down on a cutting board or hard surface, not holding it in your hand.